So what kind of medications might be prescribed to a woman who's experiencing infertility?
So we have several different levels. So I think the easiest and first level is a medication called Clomid or clomiphene citrate or Seraphine. And then there's also a similar medication called letrozole. And both of these are medications which will induce ovulation.
We often hear Clomid, and this is given when you're doing, I believe, the in vitro fertilization every month for a woman?
So
How do they
that's
take
actually not in vitro. So this is just for a woman who is not ovulating. So the polycystic ovary patient would be the first one that I would give this to, a woman who ovulates infrequently. And what that does is it increases ovulation and stimulates ovulation.
So how long do you have to be taking Clomid, let's say, to see results?
Clomid is given for 5 days. So we would induce a menstrual cycle, start a menstrual cycle, and then on day 3 or 5, you start the Clomid. You would take it for 5 days. Typically, you'll ovulate roughly 7 to 10 days after your last pill. And then you'll get a cycle or you'll get pregnant.
And the side effects, are there side effects to Clomid?
Clomid, very few side effects. About 10% of women who take Clomid will get twins. So whereas the natural rate of twins is about 1%, if you take Clomid, it's 10%.
Wow. Now, so it obviously increases the chances of multiple birth, and these multiple births end up being healthy multiple births, or do you run a risk of, again, if we've been talking about infertility, about miscarriage or anything like that?
No, there's no increased risk of miscarriage with clomiphene.
Now, some women may be offered injected hormones. So how does the injection differ from, let's say, taking a pill? So
the pill, as we say, is the first step. So if we give you the pill and we can increase the dosage, so we can increase the dosage 3 or 4 times. When people take Clomid, usually recommend that you try for no more than 6 months. If you don't conceive within 6 months of taking the Clomid or the letrozole, then we would suggest that you go to injectable hormones. And the injectable hormones are a much stronger dose of hormones than the oral medication.
Are these also taken in a 5-day span, or these?
No, these are taken, you would go see a fertility specialist. They were given anywhere from 7 to 14 days. Depending on what protocol you're using.